Hi, this is Dr. Kirk Lozada. I'm a facial plastic surgeon and rhinoplasty specialist at Penn Medicine Becker ENT, and this is 2-Minute Consults. Recovery after facelift surgery is typically around 2 to 3 weeks. For the first week after surgery, patients expected to have bruising and swelling in the face and the neck areas. They typically stay inside the house for that recovery period to allow the bruising and the swelling to resolve. After the sutures are out a week after surgery, that second week after surgery is typically more of a social downtime. So you can be more out and about, you can cover the incisions up with some makeup, and you can certainly hide things more with either some scarves or some shirts and making sure that you can meet people and be out, but typically it's not a time where you necessarily want to be meeting with friends and colleagues who you don't want to know that had the surgery done. But after this second week is finished, patients typically feel comfortable to go back into the workplace or into the more social environment 3 weeks after surgery. There are different types of facelift surgeries, from mini facelifts, which can be done effectively in the office, up to a more involved deep plane facelift, which I typically do in the operating room. It really involves the discussion with the patient and understanding what their anatomy is, so how things look, as well as what their goals are. A mini facelift in the office can be an effective treatment for the right candidates, but is not for everyone. And if patients typically have more advanced signs of aging, whether that's in the neck, the jawline, or the face, sometimes we do have to recommend doing a facelift in the operating room as opposed to in the office. A mini facelift in the office can be a very effective surgery for the right patient. It typically involves smaller incisions around the ear here, smaller dissection area underneath the skin, as well as a little bit more of a limited result because we're not mobilizing things like the SMAS as much as we would in a deep plane facelift. But for the right patient, it can be a very effective treatment.